Uganda prison spokesperson Frank Baine says that nearly 80% of the inmates discover their HIV status on admission. This has been made possible by the prison service policy of pre-admission test of HIV for all prisoners. Uganda prisons currently has 79,590 inmates, and 15% of these are said to have HIV, according to a report by Uganda prisons. These inmates are said to struggle to access HIV treatment after their term of sentence ends and they are discharged. Some are said to be chased away from the hospitals, turning back to prisons.
So we find a lot of defaulting actually when they go out. I get surprised. The other day I was at our staff clinic. We have people walking from Chengera. There was one from Nabweru. They get their drugs from staff clinic. When I asked them, they said,
Frank Baine says each inmate is provided with ARVs to cater for just 1 month and a special card for easy access to medication after being discharged. These efforts have, however, not yielded much, as follow-up is hard due to lack of documentation. Baine says these ex-convicts tend to find life in different places once released. With no clear documentation, not many can be traced except those who go back to prisons. Majority of these report dropping medication due to several factors.
When a person is free, they move the way they want, they behave the way they want. Actually, some of them, when you are asking them when they come back, he said, zebendagara na bivako, ntiruachi. Tani omanyi nedagara mirango olia. If I'm not sure of when I'm going to get the meal, how do you tell me that I should eat? That I should take the what? The drug.
Stakeholders suggest that these don't just consider HIV test, but also mental health check-up, with majority distressed by the arrest, sentence, and the prison environment. This is said to be affecting medication uptake.
And when he mentioned that these are people who have defiled and so on and so or accused of defilement, that means they are not behaving in the normally. That means they may have mental issues actually.
A lot of it is subtle and expressed either into people going in alcohol abuse,
they should say when we are driving
addiction
on the road.
Addiction to alcohol.
That's the clear
Somebody is trying to
manifestation.
deal with an issue, probably it's depression.
Frank Baine acknowledges mental health has not been given much attention given the limited funds available to the prison services. The medical workers are also said to be few, with just 100 counselors deployed under Uganda prisons.
I think we need to invest as a country in psychiatry and counseling. The frustration in the prison, the mental challenge in the prison may generate a certain level of obsession and desperation, which is all related to mental health. Yeah.
Despite all these challenges, patients have been encouraged to take the lead in caring for themselves. The high prevalence is not just in inmates, but also among the staff. 12% of the prison staff are reported to be HIV positive, male at 10.5% against the female who are at 14.6%. HIV is also reported to be most prevalent in the northern region at 20.8%, followed by Kampala Extra at 18.5%, Southern stands at 17.2%, Southwestern at 16.4%, with the least affected East Central at 8.5%. Ramson, Church of Uganda Family TV, News at 8.